So just as a preamble, today's discussion is about the Reopen Saskatchewan plan that was announced last week, and specifically some of its implications for the construction industry. And so I wanted to bring together a panel of experts from Ministry of Health, from the Occupational Health and Safety Office, and from SCSA to talk about the various aspects of health and safety with respect to the reopening. So Collin, why don't I begin with introductions from you, then we'll go to Tim, and then we'll go to Dr. Findlater.
Sure, thanks Mark. I'm Collin Pullar, president of the Saskatchewan Construction Safety Association. And our role is very much on the side of education, providing advice and guidance to companies and individuals who work in the construction sector. With specific to COVID-19, you would have certainly, if you've been participating in any of the other town halls, most certainly would have been in contact with some of my colleagues as well through that. We serve through the entire province with our offices in Regina and Saskatchewan. Perhaps at this point, I'll let Dr. Findlater introduce himself, and as we go around and talk, I can talk a little bit more.
Actually, we'll go to Tim next, and then we'll come to Dr. Findlater. Tim?
Thanks. Tim Macaulay. I'm the Director of Environmental Health with the Ministry of Health, and my role in COVID-19 has been largely working with Dr. Findlater and Dr. Shahab in terms of the development and implementation of the public health orders that have been issued that restrict or put into place restrictions to try and control the transmission of COVID-19. My team also is actively involved in developing guidance documents for different sectors in the province on how to safely operate during these times, and provide guidance in regards to personal protection equipment. The enforcement of the public health order is done so through oversight by my area. There's 85 public health officers or public health inspectors in the province that are charged with the responsibility of enforcing the order, as well as enforcement agencies like police and occupational health and safety can become involved in some situations. So I'll pass it over to Dr. Findlater.
Yeah, I'm Ross Findlater. I'm a public health and preventive medicine specialist doctor. I've done quite a few things over the years, but right now I'm working to support the Ministry of Health in its response to COVID. So most of my background has been in Saskatchewan, either at the provincial level or a regional level. One of my past jobs was the same job that Dr. Shahab has now. So I suppose in a way, Dr. Shahab is the main spokesperson for health and I guess content area decision maker. I suppose my role now is general support to him in this communicable disease control effort. And I've worked a lot with Tim, both on the production of documents and looking at some of the enforcement issues.
Hey, thank you. We're still working to get Ray on the call. And so Ray Anthony is the Director of Occupational Health and Safety, or Executive Director of Occupational Health and Safety for the Ministry of Labor Relations and Workplace Safety. And he will be able to answer some questions specifically from the OH&S perspective, how they're enforcing and some of those things. But he will join us soon. We did do a call yesterday, and he was able to join us, so I'm sure we'll get it sorted right away. But let's dive into the first question. And Dr. Findlater, we'll start with you, and maybe hear from Tim on this as well. Can you provide the group with an overview of the Reopen plan and its various phases?
I'll jump right into that. I'm just going to give you 30 seconds or maybe 60 seconds on COVID in the province and then go into that. We've been quite lucky in Saskatchewan compared to some of the other places that you might have been reading about, like Quebec or Ontario or BC for that matter. in that we haven't yet had nearly as much disease. In fact, we've had low numbers of cases since we started identifying them in March. The peak was several weeks ago after a snowmobile rally. And so that was part of the background for being able to start changing the rules a bit, or at least planning for changing the rules a bit. Right now, we've almost got two different things going on in the province. Most of the province in the south has very little disease, and the new cases that are identified are rapidly followed up with contact tracing. In the north and then the northwest of the province, though, there's quite a different scenario. That's right now is centered on La Loche, where there's quite a significant outbreak. So, and that outbreak has really developed within the last week. Since most of the decisions were made to open up the province. I must say, I get on to a lot of long conference calls with other provinces and territories, and most of them, even if they were having a much worse time with COVID than we were, most of them had been doing planning towards easing off the rules, or at least how to make the decision on easing off on the rules. So the planning here has gone on for a couple of weeks. First trying to make sure that it was safe to do so, and then trying to at least sketch out the first couple of steps in how to do that. Living the way we've been living in the last couple of months is, it really crushes the, the economy, and it's not a very nice way to live. So if we think we can ease off safely on the rules, that's definitely a desirable thing to do. On the other hand, we're in the public health end of things. We know that, we're not having a little bit of disease here compared to the worst places because we're morally superior. There isn't any reason why, if this disease gets going, we're not going to have a lot of trouble in the province. So we have to keep that in mind, that there's no population level immunity here to it, and there's no vaccine available yet. So we got to do things carefully. So the Reopen Saskatchewan plan was released, and the first couple of steps, the first 2 steps to it, a 5-step program, have dates attached to them, and then the other ones don't. So I think part of what is going to happen here is there's going to be a little bit of taking the loosening up on the rules, and then waiting to see what happens. And then if it seems safe, then we'll keep going in the stepwise process. And if it doesn't, then we're going to have to rethink how this works. If you haven't looked at the Reopen Saskatchewan document, I read it from cover to cover last night just to make sure I'd done my homework. It's a very good resource. I mean, it describes the steps that I'll describe briefly here, but it's also got quite a number of different information pieces at the back end of it, most of which Tim Macaulay was involved in developing. So there are information, like 1 or 2 pages of information for particular situations, like camps, retail stores. I don't think there's one on construction, but there's one that focuses a lot on vehicles, for instance. So I just encourage you to look at that. That's on the website. You just Google Government of Saskatchewan and then COVID, and you can find your way to it. The 5 steps, there are 5 steps in the document. The first one is reopening some medical services. That's supposed to start May 4th. There's a bunch of things like dentistry, optometry, physical therapy, optician services, podiatry, occupational therapy, physiotherapy. So they're going to be, they're allowed to open as of May 1st. Right now, there's a lot of work going on about whether they've got, whether they have to redesign their offices a little bit so they can do it safely, and whether they have the PPE that they feel like is appropriate for their setting. The other set of openings on May 4th are, and in this first phase, are related to things you can do out in the open air. One of them is about fishing and boat launch access through the provincial parks. Another one is on May 15th is golf courses, but not the usual way. The clubhouse will be closed. And then June 1st is the opening date for parks and campgrounds generally. So the rest of the rules would stay in place while those open. Phase 2 is opening of the, basically of further personal services. Yes, okay.
Closed retail too, right?
Yeah, I can't memorize them actually is my problem. Phase 2 is a bit more wide open in terms of personal services. Phase 3 is actually where you get to restaurants, gyms, and licensed establishments like bars, and easing up on the rules and childcare facilities. There's no date attached to that. Phase 4 is opening a wider range of indoor and outdoor recreation and entertainment facilities. And in phase 4, the size of gatherings moves up to 30 people at a time from the 10 it's at right now. Yeah, so there are a series of indicators that we've thought about in terms of whether it'll be safe to continue, but it's basically whether the case numbers are increasing when the rules are eased off. The assumption is that as these rules are loosened, that people will still continue to try and maintain the distancing that they currently have been doing. So it's not, get back to normal life. It's have things a little bit more normal, but still trying to keep in place the rules that we've been living with in the last 2 months for a lot of situations. So for instance, in phase 3, when restaurants open, they're going to be at 50% capacity according to the current plan. And for almost any place that's opening up, there has to be some thought about hand washing, about spacing of the people in there, and about whether it's appropriate to use some kind of mask, for instance, for protection if you're getting your haircut, for instance. Yeah, I think that's what as far as I'll go for right now. So although there's a plan on here on opening Saskatchewan, it's not quite get back to things as they were 3 or 4 months ago. It's the rules will be a little bit easier to live with. And hopefully they'll get better and easier to live with over time, as long as we don't have a big uptick in the number of cases, in which case we may have to clamp down on things again.
Okay, thanks, Dr. Findlater. Tim, is there anything that you'd like to add to that, maybe either to the overview of the reopen plan, or the next question I want to ask, which is, which Dr. Findlater began to touch on, which is the framework that will be used for decision making in terms of the timing of future phases?
Yeah, I think that was an excellent overview on the part of Dr. Findlater. The only thing that I would add is that this is a very measured approach, and the types of facilities that have been put forward as being in phase one and subsequent phases has been a collaborative effort through discussion with health officials and elected officials. So there's a bit of a balance that is that we've tried to achieve, and so that the opening of Saskatchewan can try to bring us back to a normal state, towards a normal state, improve on the economy, but yet doing it in a safe manner that doesn't cause a significant increase in the amount of illness. The other thing I want to point out is that despite the phases identifying certain types of facilities being allowed to open, the final decision is going to be the facility themselves and the operators of those facilities, and they'll have to determine whether or not they're comfortable in being able to operate in a safe manner, or if they can implement the necessary conditions or requirements to be able to open. They decide that, and if they feel that they can't, then they're not obligated to open. In terms of the framework, and I'll defer to Dr. Findlater after a couple of points here, that the approach is going to be that you open it up a little bit, and then you observe and do an assessment of whether or not that's created issues, in many ways, issues in regards to increased illness to an extent that could be of great concern, or issues in regards to enforcement or other types of things. We're also monitoring. Saskatchewan was the first province in Canada to introduce a reopening plan. Since that time, other provinces have quickly followed with their own plans. We're going to be monitoring how they're doing in those other provinces, as well as what's going on here, to determine if adjustments need to be made.
Okay, Dr. Findlater, anything you want to add to that in terms of the framework and timing for future phases?
Sure, I found the page I couldn't find a minute ago. Phase one I mentioned really starts May 4th for the first dates. Phase two starts May 19th, and the two components are opening retail stores, and they'll be functioning in a different way than they would usually have been functioning as well, just like grocery stores do now. And then the second component that opens May 19th is some personal care services. So if people have been growing their hair for a while and want a haircut, that's, well, you'll have to probably make an appointment to get in. No, I think Kim covered off some important stuff, but be good to see what other questions there are.
Great. Yeah, we'll dive into that. Just as an aside, I have my beard trim and haircut scheduled, I think, for the 21st of May. So hopefully phase two can go ahead, because I desperately need it. So I think Ray Anthony has joined us. Ray, I'm just going to unmute you. Are you there, Ray? Ray, are you on the line? Ray? Are you there, Ray? Oh, okay, maybe not. We'll come back in a minute, Ray. Okay, that's okay. We're gonna press ahead with the first question that we had from in the Q&A. It was actually submitted by Kevin Dow from Almeida Piling. He'd sent it in earlier as well. So Collin, I'm gonna come to you to answer this one to begin with. What's the industry best practice protocol for assuring that employees are absent or free of COVID symptoms and are therefore fit for duty when they arrive at the work site? So he was asking, about things like the best practice for pre-work health assessments. And are companies gearing up to measure temperatures? And are they doing that daily, more than once a day? So can you just talk a little bit about what you're hearing and seeing for construction industry practices around assessing health before they get to the site?
Yeah, thanks, Mark. And it's a really good question. Probably the most common question that we've been hearing. And similarly, there's a lot of there are a number of different companies who are largely using the same practice I'm about to describe here right now, and there may be some very differences and with respect to temperature taking, but frankly, before an employee arrives at a site. The biggest thing that's been encouraged and the leading practice on this is really utilizing the tool that Saskatchewan Health has provided, and it's also available we have a tool called a standardized protocol, which is available both from our website, and I believe, Mark, there's a link on the SCA website as well.
There is, yeah.
That has some great questions in the appendix. And it focuses on asking some very basic questions on how they are currently feeling upon arrival or prior to arrival. Ideally, companies are able to get these questions answered by a worker before they arrive, present themselves to the site. Basic things like, are they experiencing any cold or flu-like symptoms? Have they gotten an elevated temperature, such as a fever? Are they experiencing any of the symptoms of COVID, like shortness of breath or chest pains, or have they had a sore throat? Certainly questions around their recent travel, if they've been traveling. Certainly with the health orders, folks who've been traveling outside of Canada are required to have a 14-day period of self-quarantine. But the question needs to be asked anyways. Have they been in contact with somebody who's recently been ill with showing COVID symptoms or probable or confirmed cases? Or they've been with somebody who has traveled. So those are some of the examples of kind of the pre-assessments, pre-presentation, before somebody shows up at a website, at a work site. With respect to the question on temperature taking, it's expected that employees, and our recommendation expected employees, if they're beginning to experience any symptoms of illness, to report that to their supervisor. And be sent home. They're certainly advised at that point also to complete the self-assessment as well. That's available on the Saskatchewan government's website. Some companies have elected to also incorporate temperature taking at the moment that they present or throughout the day. In the event that somebody begins to show an elevated temperature, they may not be experiencing all of the symptoms of COVID, but they are taking temperature checks in the event that they have somebody with an elevated temperature. They are asking them to step away from the job site until they can be further evaluated and self-assessed. So those steps are not necessarily requirements by law, but those are practices that some companies have been using. Some general contractors that I'm aware of have used that to some degree, but I say some and not all.
Thanks, Collin. So Dr. Findlater or Tim, anything from your perspective on the question of what practices companies might want to be doing to monitor health of employees before they come to site, and whether or not things like temperature checks, I know those are being required now for health facilities and things like that, at least I think they are, if I understand. So any thoughts on the appropriateness of using those in most workplaces, or specifically on construction sites? Oh, you're on mute there, Dr.
Yeah, I was, Ross, I was trying to think through what my opinion was on how much of that you should be doing. Certainly it's, symptom screen's pretty easy. And that's really just, you can either post the list or you can ask people about it, I guess. So, and I guess you need to use a good list. One of the good lists is on the screening tool that's on the website for the Government of Saskatchewan COVID response. So, I mean, there's quite a variety. And one of the things that's been interesting, I guess, with this particular infection is that there's a mild end of it that people are have either very few symptoms or their symptoms are so minor that they might not realize they're sick. So if you look at the list, it's from fever, headache, chills, cough, shortness of breath, sore throat, runny nose, and a really odd one there, a diminished sense of smell or taste is kind of an unusual symptom that's popped up in the studies in the last couple of weeks. But that for some people, they may not have a fever when they're going into the workplace, and they may only have a runny nose or a very mild symptom and wouldn't have otherwise thought they were sick. So I think it's important for the screening that people do it deliberately, and they don't have to think that they have to be dying to be identified as sick. If you do get those symptoms, then you can, go through the healthcare system to try and get tested. And we don't think that there's any problem in the availability of tests right now in Saskatchewan. One easy way to go there is through the 811 line, but family doctors can also arrange for testing, and public health can as well. Thermometers are a different issue. I mean, I think they're hard to buy. And I think if I was running a construction company, I might look at the risk in either in the place I was working at or the kind of context. Like if you were in a work camp, for instance, it might be more important to try and build in a temperature check because that's an ideal place for the virus to get transmitted around. If you're in an area where there is a lot of coronavirus known to be, then it's more important to build in the temperature check as well. It would probably be useful to have a thermometer, even if you're not checking everybody's temperature every morning when they arrive. Anyway, that's where I got to in an opinion.
Thank you. Tim, was there anything you'd like to add to that?
Yeah, just a couple of things. In terms of the temperature checking, it's just been of recent time in terms of the public health order that we've put it as a mandatory requirement for healthcare facilities, type facilities. And of course, whenever we impose a requirement, there's always a challenge in regards to obtaining the necessary equipment. And so I do echo what Dr. Findlater just said, that the thermometers are difficult to find at this point in time, and that's largely because of the demands from healthcare type facilities. What I heard, and I agree with from Dr. Findlater, is that if temperature checks could be of use, but they should not be the only tool that is used, and it's more a supplementary tool that is used as part of the overall health screening that should take place. Yep, that's it.
Thanks, Tim and Collin and Dr. Findlater for that answer. I think the takeaway, Kevin, for the person who asked the question, is the pre-health assessments is common. They're being used, we know, right across the industry, and a great tool. It's definitely something that you should be looking at. The temperature checks, context is important, and you want to bring the right tool to the job, and may not be appropriate in every situation, and you may have a challenge in terms of scarcity of supply too, which is important. Okay, I think Ray can hear us, which is good, and I think he's unmuted. Are you there, Ray?
Can you hear me?
Yes, we can. Yay, this is wonderful. Okay, it's a Friday miracle.
Yeah.
That's good. I'm glad. Well, I'm glad to have you then, Ray. Why don't you give a quick introduction about who you are and what you do, and then I'm going to bring the next question to you, which is going to be about vehicles. But why don't you tell us a little bit about who you are and what you do?
Okay, I'm the Executive Director of Occupational Health and Safety within the Ministry of Labor Relations and Workplace Safety. I'm responsible for the 65 field staff, which consists of hygienists, ergonomists, radiation safety people, and the field staff that actually do workplace inspections, come out and visit your work sites. So That's my involvement here.
Thanks, Ray. So one of the questions that we've been getting, of course, as you know, right from the very beginning of this is the guidelines around company vehicles. So the reopen plan really actually, for the first time, really addresses some of that in written form in terms of what best practices can be. And as I understand it, Ray, the recommendation has always been, as much as possible, have one person in the vehicle, but it's been a recommendation. It hasn't been an order. And so as I see in the plan, it begins to outline some of the things you can do to mitigate the risk if you have more than one person in a vehicle. Ray, can you give the OH&S perspective in terms of where we stand today as a province in number of people in a vehicle? And yeah, I'll start there, and I may have some follow-up.
Okay, well, let me point out a couple of things right off the hop. First, construction is what we call prescribed place of employment, and that means you fall into Table 7, and that means you have a safety program. You have an occupational health and safety program, and part is that you're going to do task hazard analysis and write safe work procedures. So right off the bat, the way Dr. Shahab has written the medical health order is that you should maintain the 2 meters distancing. So if you can't do that, you need to write a safe work procedure around what you're going to do if you're not going to be able to maintain that. So let's say for whatever reason, you have to put 2 people in a vehicle. You need to have a safe work procedure around how you're going to do that. Now that said, there is a duty, an onus on the employees to disclose anything that might injure themselves or someone else. And so if they take the self-assessment online, or the employer has a copy of that and they review it with the worker should disclose that they have an illness or a problem. All right, so now that said, you've got to put 2 people in a car. If you have to do that, you're going to have to practice the idea of washing your hands, taking care of the wiping down the car, those sorts of things. If you have to go there, you have to take those practices. And so the employer should have a policy as to what that will be in writing for the employees.
Okay.
Okay.
Yeah, that's helpful. Thank you. So then for Tim or Dr. Findlater, and Tim, I know that you were one of the ones responsible for helping craft some of the language in here that talked specifically about transportation. So that's one of those documents at the back end that Dr. Findlater was referring to, and I'm just flipping back here to find it. But do you want to talk a little bit about the specific requirements that are in here and any advice or guidance you would have to supplement what Ray had to say? So it's on page 21 for those who have the guide.
Yeah, thanks. So what we've tried to do through these guidance documents is come up with practical ways of trying to mitigate the concern of transmission when you can't maintain the 2 meter distance, and so the document, for those that have not looked at the document, it's a good, as has been said before, it's a really good resource and has some I think helpful information to assist in trying to protect the employees. And so things like when you can't when you have to have more than one person in a vehicle, we've said if it's 2 people, and if it's in a car or if it's in a crew cab type vehicle, that you would have the driver and then the other person in the back seat is one way of trying to maintain separation. Another is to have the vehicle and the occupants assigned for the same people. So like you would have Larry and John working with that vehicle, and Larry and one of them will decide who's the driver for that day, and they stay the driver for that day, and you don't flip back and forth, so that that prevents the concern or reduces the concern in regards to transmission of the virus through through surfaces that could be touched by other people. Try to distance yourself as much as possible in the area of the vehicle. Airflow in the vehicle should not be set to recirculating. You try to get fresh air into the vehicle as much as possible, and then just frequent cleaning and disinfecting of the vehicle and the common touch points like the steering wheel, the gear shift, the dash, the radio, the door handles, and armrests and seat belts and so on. So those are the types of things that I think can be easily implemented with some thought on the part of the employer, and I strongly encourage folks to refer to that document.
Mark, I could probably even just add to Tim's comments, and just a reminder for folks to not have other people jumping in and out of that same vehicle, which is it's something that we've been very comfortable with doing up until now. But to, as Tim has indicated, to make sure that the people that are assigned to that vehicle and the spot in the vehicle, that they would maintain that for the day to keep themselves separated. A very similar thing could be applied to the work zones that people may be assigned for the day on a work site, to minimize the amount of travel for an individual between those zones, ideally for that person to work in that zone for that period of time, just to minimize the potential spread if there is somebody who is carrying the virus.
Collin, I wanted to specifically follow up on that a little bit with you. So Megan has been posting the resources, the SCSA resources that have been available on that. But we did have a question from a couple of people specific to this that I think your policy touches on. So the policy that you have for vehicles does talk specifically about what the best practices are, right? And how companies can create policies to manage when they have more than one person in a vehicle?
Yeah, and it's not it's not really any different than what Tim has described, although in there may be situations where additional protection may be placed where somebody may wear a mask. Some companies have talked about wearing not necessarily an N95 mask, but something to minimize the amount of moisture leaving the mouth, and preventing if somebody happens to cough or that sort of thing. And the resources that Megan is posting, I'll assume, will be from the standardized protocol document. And so there's a fair bit of information that could help companies in just I guess putting in writing for themselves what their practice will be when and if individuals have to travel together in a vehicle.
Perfect, thank you. Reminder to folks that you can add questions in the Q&A feature. We've been doing that and answering them as we go, so that's good. I do want to follow up about masks and maybe start with you, Dr. Findlater, although open this to everybody. I think there's a lot of confusion about when certain masks are appropriate. So specifically, there was a question here about, if you've got more than one person in a vehicle, should you be wearing a mask? Would this be recommended? And there's different types of masks, and I've heard of stories where contractors are requiring N95 masks on site. And so can you give the medical perspective of when masks of that degree are required, and specifically when it comes to addressing COVID-19, what the role of, when that level of mask is appropriate?
I think, there's a lot of interest in masks. I think so. The clearest thing, and there's several types. The N95 masks are something that I just think of as necessary for healthcare settings where there are high-risk procedures being done. So that's a specific set of aerosol generating procedures. And for most circumstances where a mask is required, like right now, there's an order out there that requires all direct care staff in long-term care facilities and in acute care hospitals to wear masks as part of their daily way of working. And they're using procedure or surgical masks, which are the simpler masks that are used as part of droplet and contact precautions in hospital settings and long-term care facilities. So they're the appropriate level for most settings in healthcare where the risk is higher than it will be in normal work sites. And in healthcare settings, the N95s are really limited to these aerosol generating procedures. I think there are some circumstances in occupational health where you need an N95 mask for other things. So we're certainly not telling you that a surgical mask is good for everything. There will be other things that you need that level of protection. N95 masks are, they're a bit more expensive. They're in shorter demand right now, and they need to be fitted. So in a healthcare setting, you figure that if a person hasn't had that mask tested for a seal, that they might as well not be wearing it. That's not going to protect them. And people with beards, Mark, you couldn't wear one, are one of the kinds of people that actually can't wear these because they just can't be fitted over a beard. So you shouldn't think of N95s as the best possible option for for everything. It's got some appropriate uses, but for most things, the surgical or procedure mask is the right thing to use, and it's part of standard healthcare protection against certain organisms. The third category of masks is these cloth masks. They're not really medical grade. They can be made at home, or people can make them and sell them. The wearing of masks. We probably all remember pictures of China in January and lots of people wearing masks. And 2 or 3 months ago, the Canadian take on this was, well, that's kind of interesting. But not necessary, and a little bit foolish maybe. But now we've come to face that the surgical and procedure masks are in short supply here, and there's been a different take on the role of the cloth face masks to accept that there is some level of protection from them. Likely, they haven't really been studied well enough for long enough with fancy enough studies to know exactly how much, and it's lower than the surgical or procedure masks. But it is something that you can do to protect yourself in a setting where there aren't any other kinds of masks available, and you really just can't separate yourself from other people. They're more likely to protect other people from you. So they catch droplets on the way out. They might catch a few on the way in, but they're probably better at catching the droplets on the way out. So people wearing them are probably protecting other people around them a bit more than they are themselves. But it all reinforces, that you have to be careful when you see somebody in the store wearing a mask. It reminds you that you're not in normal times, and you don't want to get too close to them, for one thing.
Perfect. Thank you, Dr. Findlater. Ray, Dr. Findlater referenced the fact that there are times when a N95 mask might be needed in construction apart from COVID-19. So he did a really great job of explaining where it is appropriate and not appropriate for COVID-19. But do you want to add a little bit to that and just provide the perspective of other times when a mask like that may be necessary?
Okay, can you hear me, Mark?
Yes, we can.
Okay. If you guys review Regulation 88, it talks about the use of respirators, and the requirement is on an employer to supply a respirator, and it has to be fit tested to that individual when they're involved, in a process that would create perhaps gas or a dust or something like that. I think the N95s that we see in construction are commonly used when we're creating a lot of dust. Like, you often see drywallers wearing them when they're sanding out. Sometimes you see carpenters wearing them when they're creating a lot of sawdust or that sort of thing. Occasionally, if we're doing an asbestos abatement, you might see someone wearing a respirator during those operations. They're certainly not unknown to construction, but they're in this case, it's a little different. It's being done for a medical application. And I think, as the doctor said, like, there's sort of two levels of that. One is standard surgical mask that prevents you from contaminating another person and does provide some level of protection. And then there's the N95, which is actually a respirator, albeit a disposable, a throwaway one. And they're very common in healthcare and in construction as well.
Okay, thank you, Ray. Okay, this next, I got a couple of questions in the Q&A, which we'll come to in a second, but I want to move first to talking about office staff and working from home. Maybe Tim, we can start with you on this one. So I'm just going to unmute you. The plan, I think it's on page 3 of the plan, basically says if people can still work from home, they should work from home through all of the phases if possible. That's not going to be practical in all cases, and it's probably not going to be desired in all cases. We know that it's still recommended, though. So what framework would you recommend that companies put into place to make a decision about when it's appropriate for their workers to return to the office? So specifically here, talking about office staff. And should they be looking at doing that maybe in steps, in some sort of gradual process? So just what would you recommend for companies in terms of how they make the decision about when and how to return to work?
Yeah, thanks, Mark. I think just to give you some context, I work in the Ministry of Health. It's a large building. I think there's over 300 and some staff in the building when we're at full strength. And currently, although I still come into the office, I think there's only 10 people in the building. And so that gives you an indication of how seriously we're taking it in terms of reducing risk of having transmission within the Ministry of Health, and how we can continue to do business even from home. I think although there's allowance for people to return to their workplace, the advice is that you use the same type of approach that you would, as we discussed before, with the work sites, that there would be some sort of screening check that is being done, whether temperature is part of that, I'm not sure, but definitely you want to maintain the physical distancing. You want to make sure that there's increased cleaning and disinfection of the common touch points. You're wanting to make sure that people that are demonstrating any type of illness that are excluded from work, and that you would want to discourage people from carpooling to work. So those are some of the things that I would recommend.
Perfect. Thanks, Tim. Dr. Findlater, anything you want to add from the health perspective? And then Ray and Collin, I'm going to come to you from the enforcement and recommendations perspective. But
no, really, it's just that we're not in normal living in the next few months. We'll get there at some point, because this won't last forever. But people have to try to stay safe for the next while. And we think there are some measures that can be lifted pretty easily. And there's going to be some risk to lifting more extensive measures. And anything you can do to kind of keep the social distancing and the protection intact there in the next month or two is a good idea.
Thank you. Ray, and then Collin. One of the things, of course, I guess I'd be curious about from an enforcement perspective is there is still going to be this expectation that employers, if you're going to have people in your offices and things like that, you will be following physical distancing, right, and all of the other protocols that were outlined. That'll still be expected for an extended period of time. What role do you see for OH&S in making sure that companies are doing that, and what advice would you have for companies in terms of how they, if they do want to bring their people back to work, how they can do that safely and make sure that they're in compliance?
The first thing I would say is, again, both in the office and can you guys hear me?
We can now. Yep.
Okay. As a prescribed place of employment, whether you're in the office or whether you're on site, you're required to have safe work processes. So I would make sure that you develop a safe work process, not only for the site but for the office. And what I'm speaking of here are those tasks where you're not able to comply with the specifics of being 2 meters apart. So I mean that goes everything to, as Dr. Findlater said, like maybe you have certain traffic patterns in the office, so people are not forced to try and get past one another in a narrow hallway. I know we have that problem. On site, you might actually start scheduling the work in shifts. There's a number of things you can do to reduce the exposure of trades to one another. Again, speaks to scheduling, so you don't have everything kind of jammed up at the end of the month or toward the end of a project. Perhaps extending those things out. But again, most of this should be done in writing and through a policy. The other thing I will comment on, just the day-to-day stuff. Like, I mean, if an employer goes to the trouble to give you a mask, the workers should wear it. We have seen a lot of it where we go out and they're wearing them on their heads. I mean, if the employer has gone to the trouble to provide you with that, they should enforce the use of it, because again, you're not creating the right sort of culture. You're not creating the right sort of environment. The other thing is, when you draft the policy, it should indicate that there are going to be consequences if it's not followed. We seem to have seen a number of things where guys simply think, well, we'll just step off the site and have a smoke and it's none of the employer's business. Yeah, it is, because when you step back onto the site, you have to go through the whole rigmarole of self-assessment prior to returning to the site. So that's my 2 cents on that.
Thanks, Ray. Collin, do you want to talk again specifically about the office perspective and what employers can be doing to just put themselves in a position for success here?
Yeah. I mean, a lot of it's just builds on a number of things that Ray talked about. People coming back to the office, staggering their start times, and not everybody having a break at the same time, and that may even include lunches. And, if you've got a lunchroom that can't accommodate physical distancing, that perhaps different accommodations be made for people to have lunch separately, whether it be in their own vehicle or in their own office, in order to keep separated. Ray talked about narrow hallways as an example, which we commonly deal with, and the one-way staircase, or the halls where people just go one way. We've seen in a number of grocery stores here recently. That can certainly minimize worker contact with each other. And giving enough time to be sure that there is proper cleaning and disinfecting, whether it's a common tool that people use, that we limit the number of people using that tool. And I mean, a common piece of machinery in the office, maybe a photocopier or something that a mail machine or something. That there are a reduced number of people that are operating that machine, that it's that ensure that thing is thoroughly sanitized between users of that particular equipment. And I talked earlier about the concept of keeping people in zones. In order to minimize, I'm going to say, cross-contamination by an individual who is moving through several zones. And so where that is possible, it's a good practice to have. So, and so certainly even in my own office, even though we have a minimum number of people in that office, we frequently will still video conference each other. Even though there may only be 3 of us in the building, we still video conference each other, even though we could go into a boardroom where we can maintain distance. We still work on doing that. So, the last area, because there will still be for some time people working remotely. And while people are working from their residences, one of the things that we want to remind people that they should remind their employees is to check the workspace that they're working in to make sure that it's free of hazards. Right in our own home, we'll have extension cords and all these things we've now set up to run our computers and printers and things off of our kitchen table. But still, the practice of taping down cords and making sure that that the area that we're working in doesn't lead to an incident right in your own home while you are working. And I think we talked about this earlier in another town hall with some of the challenges with working remotely include added stress and sometimes mental fatigue for people. And in the construction industry, as in many others, there's long histories of times when people have had serious mental illness, or just general challenges with dealing with mental health. And often the worst thing you can do is separate yourself from everybody else when you're in a bit of a crisis, or even before you reach crisis, and suddenly we're in a circumstance where we're told to isolate ourselves from one another. And so employers should really work to be sure that their workers have access to mental health resources, that they're checking in regularly, that they've got a contact right back in the office. And that's certainly, these are practices that that can make sure that people don't feel too isolated and separated from their colleagues.
Thanks, Collin. So one of the things, I've got a couple of questions here we want to get to. Actually, why don't we move to one of them first? So this was a question we got actually ahead of time, and somebody's put it in the Q&A feature as well. Dr. Findlater and Tim, this would be for you, and it's specifically about the most recent public health order around travel restrictions for the North. So, and the question is, why was the whole North closed off when it seems like most of the cases are specific to the Northwest? And so just asking for a little bit of clarity in terms of why the public order included the restrictions on travel for all of northern Saskatchewan. And I don't know, Dr. Findlater, if you want to start us off and then hear from Tim. Sorry, you're muted, Dr. Findlater.
Maybe okay, I'll start. And Tim, you've got about a minute to think of the real answer here. But I think there had been, that may have looked like it came out of the blue, but there had already been, the outbreak in La Loche had already started about 10 days ago. So I think I mentioned at the beginning that that's represented the importation of a case from Alberta, from a work camp. About 10 days ago, the medical health officers up there issued a travel advisory against any travel from northeastern Alberta into Saskatchewan, northern Saskatchewan. There had also been a similar travel advisor in northern Manitoba, which has been in place a bit longer, perhaps about a month. And there certainly have been a number of northern communities that were trying to prevent importation of disease by creating local blockades or local entry processes to try and make sure that the disease, I guess they thought at that point it was in the south, could get into their community. Exactly, but at some point there becomes a political will to put in place a rule, and I guess that happened. Tim, do you want to add anything to that?
Yeah, sure. So this happened last Friday. I think it was, it resulted from a number of things. So the government was hearing from First Nation community leaders and others in the north that there was a lot of concern in regards to COVID-19 transmission in the north, and the concern in regards to how that would affect some of the communities, given some of the conditions up there. There's been local First Nation groups that have put up their own blockades for communities up there. Those blockades are not enforceable by law, and there was some desire to have something put into place that it could be enforced by many different enforcement agencies, including the police. And so the approach was perhaps more of a preventative measure in terms of the extensiveness of it, so that it was the entire north versus just some areas of the north. But that approach is being used in some other jurisdictions. For example, the Northwest Territories, there's a blanket restriction for entering the Northwest Territories and Nunavut, and I believe some other provinces, and then some sections of provinces like Manitoba. So I think as we have further discussions, as government has further discussions with the northern leaders and public health officials in the north, you might see additional orders or a refinement of the current order to be more specific to some of the areas where there's a significant concern.
Thanks, Tim. So hopefully that answers the question. For those participants, just so you know, we are using a polling feature during this call today too, so asking some questions for participants based on some of the conversations that we've been having. So right now there's a poll open on has your company moved to a one-person per vehicle policy during COVID-19? So the panelists can't answer this, but the participants can, and we'd love to get your answers, and there'll be some more throughout. One of the things that I would ask, I guess, next question here from the group came from Troy and Collin and Ray. Maybe we'll start with you first, Collin, and then hear from Ray. What should we, so this is a company where they're not really able to do physical distancing very much. And so a large portion of their work doesn't allow for distancing. Two people have to work in close proximity. And so if you have the consistent team and you're kind of working in zones and things like that as suggested, do you have any, the question is, should we be wearing masks? But also, do you have any other suggestions for how we protect the folks? So maybe Collin, we'll start with you, then hear from Ray, and then we can go over to the folks from health.
Yeah, sure. Thanks. And this is pretty common in construction. Obviously, there's circumstances where two people are involved in installing a window or something like that, where the window's only 4 feet wide. You can't keep a 6 foot distance from each other and still get the work done. In those situations, and Ray could speak in much more detail on this around ensuring that there's a safe work procedure put in place for how to manage a circumstance like that. And that should be in writing with that the employer puts down in terms of a plan. Yes, in those circumstances, I would certainly include incorporating some forms of PPE. We talked earlier about masks, and the fact is that in most cases, perhaps a surgical or a cloth mask might provide an added layer of protection in terms of preventing droplets from getting onto the other person, but also things like frequent hand washing, appropriate use of task-specific gloves if the circumstance requires that. That those types of elements used, could provide some added protection. But in terms of the requirements, certainly there needs to be a very written plan by the employer on that. And perhaps, Ray, you could speak even a bit more about that particular area.
Sure. I know that the coronavirus is kind of a recent thing, but even when I came back to the ministry 20 years ago, hepatitis was a big deal. And if you look at the way that the legislation is structured and think of it in terms of construction, it talks about general housekeeping. Well, okay, that could be if you have a truck that you're using to run around with or whatever, that it should be cleaned at regular intervals, given the current case that we face. The other thing is that you think of how construction workers typically work. At some point, they're going to need to use the washroom. You guys provide porta potties or washrooms for them. Those are going to have to be cleaned a lot more frequently now, because that's a target point, that's a trap point of frequent touch where your people are going to go. Then when they leave there, they have to have some means of cleaning and sanitizing their hands, because the next thing they're going to do is eat lunch. And again, you don't want to crowd them all into a trailer. You're going to have to stagger those things and sort of have a plan as to how you're going to try and maintain some distance. And then after they use the lunchroom, clean it up before the next crew comes in. Those type of things have to be thought of and arranged. And they should be on a regular basis, not just through this COVID-19 thing, because, I mean, we have all sorts of things that appear in construction and rural sites and those sorts of things, like hantavirus, hepatitis, all those kinds of things are with us year round. And so there's a reason why those appear in our regulations. That's it.
Thanks, Ray. Dr. Findlater, anything you'd like to add to that?
I'm not sure if we talked about this yet, but the idea of if you've got a couple of people together, if you make them into a team, and in the healthcare system, we call this cohorting. If you keep the same staff together, instead of mixing them with a bigger group, then you're creating less risk by doing that. So I guess that would mean, you keep people in the same teams. Health checks, of course, are part of what would protect you even in that situation. And I think one thing that we think of, or we don't think of too often, is ventilation. If you've got a chance to have more ventilation rather than less, you're in a situation with less risk.
Perfect. Thank you. Tim, anything you'd like to add?
No, I think that the main points have been covered.
Okay. We'll start with you, Tim, on this one, and then hear from Dr. Findlater and others. We've heard a lot about the importance of cleaning and disinfecting, and the document, the Reopen Plan, actually articulates the difference between disinfecting and cleaning, which I thought was interesting. But throughout the document, there's use of words like frequent and often, and I'm curious, what does that mean from a practical sense? How do you decide what is enough frequency in terms of cleaning and disinfecting?
Yeah, and it's pretty hard to be prescriptive when it really depends on so many things. And so I think it would be dependent on how many times are those pieces, that equipment being touched by others. Like I'll give you an example. I have friends that are saying, well, they're forever cleaning their phone and items within the house, but then they never leave the house. So I'm going, well, I don't know what you're doing, but I think you have to use some discretion and common sense that if you have the potential for others to be touching equipment or items on your desk or whatever, then I think you clean and disinfect it as frequently as you think is necessary, or I would say 2 to 3 times a day for sure. But it's going to be dependent on usage and the situation.
Okay, that makes sense. Dr. Findlater, anything you want to add to that?
No, you just need to look at what you're doing in your own situation. I'm sure you've seen in this grocery stores that the grocery carts are getting their handles cleaned every time.
Mm-hmm.
In the places that are doing a good job anyway. So it really depends on how many people are touching that particular surface.
Right, so the frequency really is dependent on, like context dependent on the number of people touching it, how often it's being used, how it's being used, and right.
Yeah.
More cleaning isn't going to hurt necessarily either, I suppose.
You know,
Ray, Collin? Yeah, go ahead, Collin.
Yeah, I guess what I could add to that is just, starting back at the personal level with the personal hygiene and the fact that our hands are going to be coming in contact with items, and that first starting off to ensure that we're doing frequent hand washing and where soap and water aren't available, certainly using a sanitizing solution. But things like sharing tools, sharing equipment, there's some thought that needs to be put into certain things. I mean, certainly we typically don't see people having to share the same hammer. So, the frequency of having that hammer cleaned after every time it's picked up and used is not put in the same context as someone who's using the same ladder for a number of people to utilize, and that the ladder that you've got several people using probably requires more frequent cleaning or just sanitizing, disinfection than others. But very practical things such as if people are physically using pens to sign in and out of things, that they're not sharing the same pen. If they have to share the same pen, that is sanitized. Ray talked about washrooms and touch points like doorknobs and those certainly those things need to be sanitized much more frequently, and back to trucks, other pieces of equipment that may be shared by more than one person. Ideally, you only have one person assigned, as we talked about with vehicles, but there's other equipment such as forklifts where you may have 2 or 3 people that are utilizing that piece of equipment over the course of a day, that it is also frequently sanitized, and just the points around work site hygiene. I mentioned in the standard protocol document there's an appendix that'd be kind of helpful, that's got a sanitation checklist in it. Just as a reminder, or as a starting list for companies, for their workers and supervisors to go over and say, hey, are we cleaning these things at an appropriate frequency, considering how many people may be utilizing that piece of equipment.
Collin, would you, I see there's a few questions that have come in today for construction specific scenarios, which I think are things that are certainly appropriate here, but also can be addressed through the Ask the Advisor sessions that you guys are putting on. Do you want to give a little plug and explanation to how people can actually?
Sure. Yeah, no, thanks, Mark. At this point, a couple days a week, I believe it's Tuesdays and Thursdays, the SCSA has a webinar called Ask the Advisor webinar, and it's a live session, and what we found is that a lot of these types of questions will come up, and we'll have a group of advisors that can give some advice, suggestions, point you or share some resources with you, whether sending them out directly or ensuring that we've got that updated in on our website. And that should be really, it's been very helpful for a lot of companies. And some of the checklists that I just referred to are items that are also on there. Actually tomorrow, being Thursday, the session that'll be put on will actually be focusing specifically on the standardized protocol and some of the checklists that I was just referring to. So that may be very helpful to folks who are on this call right now. It's typically in the morning at 9 a.m. and you can find on our website, it's a Zoom call just like this one.
Yeah, and Megan just has sent that out to everybody too, so they'll have the links to access that, which would be great.
Okay, great. Yeah, thank you.
So I have a couple of, I think we have 2 more questions that we're going to get through in the time that we have. On page 12 of the reopening plan, there is and I'm going to unmute you, Tim, here. Page 12 says, all businesses must have a workplace illness policy. And if a policy does not currently exist or does not align with COVID-19 recommendations, the following should be included. And then it has some sub-bullets. So this is a question I actually didn't know. I mean, we had one here at our office, and I don't know if Tim or Ray would be better positioned to answer this, but was this a requirement before? Did companies have to have a workplace illness policy, or is this something new? Does anybody know? Tim?
Well, I think the way I interpret that is in the context of the public health order, and the public health order states that that where an employer cannot have its employees meet the 2-meter distancing requirements, then they need to have other measures put into place, and that includes things like self-monitoring or supervision by the occupational health and safety in the workplace. And so in terms of occupational health and safety in the workplace, that the workplace illness aspect would form part of that. And that's the way I interpret that.
Okay, yeah, and I didn't have any issues with it. It was one of those things where I wasn't sure if that was something that was required today, and it does sort of create a positive duty for employers to make sure that they do have a policy in place. Ray, do you have any thoughts on that?
I think he's hit pretty well right on the head with it. I mean, especially in the endeavor that these guys are in, the construction one, again, you're required to have a safe work practice. As employers, you become aware that there is a hazard to your workers, and you're required to take action to do something about that. And so, given that we have an order from the Chief Public Health Officer, and it spells out what the risk is, and some recommendations around getting around it, where you can't comply with that, you're going to have to take steps to satisfy your workers. And unfortunately, we are already starting to get a number of work refusals on this stuff, you guys. So, I mean, we just as soon not have to deal with these. They're a lot of work for us, and given if you're handling them properly, they have to go through the Occupational Health Committee, either at the site or through the company. Yeah, I mean, best to take the precautions, frequent washing, sanitation, and self-assessment if you're going to be within that 2 meters.
Okay, thanks, Ray. And so I just wanted to make everybody aware that is something that's listed in here on that page 12. So if you haven't reviewed it, you should, and it does list a few specific things that you should make sure are included in your illness policy as an employer. I also would point out, and it starts on page 16 and also on page 17. And Tim, I don't know if you have any comments on the content in here, but page 16 and 17 walk you through as an employer a series of questions that you should be asking. And I know most employers in the construction industry that were continuing to be active over the last number of months will have worked through these questions, but if you haven't, you should. And Tim, do you have anything you want to add in terms of the content in these questions and what sort of drove the creation of this list?
Sure. I think this is just sort of the continuation of the workplace illness policy, and so you know, what we're outlining in the document is some pretty simple steps that the employer should be doing to check on their workers, and so ranging from telling them. Explaining to them about COVID-19 and how it's transmitted, to looking at what systems they have in place to protect the employees' health, to taking a close look at the practices of the workplace in terms of where there's some trouble spots where the risk is greater than others, and then implementing control measures for that, to controlling the number of people in the various zones or during work breaks, to PPE. And I think it's just a really good guide to help walk you through the causing you to focus on things that may or not be happening now when you're dealing with your workers.
Thanks, Tim. And that's perfect. Thank you. So the last question I have today is going to go to you, Dr. Findlater, and it is, I guess, a question. When you started off in your comments at the beginning, you said, you know, we're not, or early on, you said, we're not going to be in this situation forever, right? I'm paraphrasing, but and this will go away. But we have things that we need to be focused on now, and we need to be taking steps individually and collectively. Is the end here when we have a vaccine? Is that, I guess what I'm trying to ask is, you know, where do we need to get to as a society before this is behind us, and how are we doing in terms of making progress towards that goal globally, from what you know? And you're on mute.
Yeah, good. There's a couple of ways we can get out of this. I guess one is the vaccine. So that'll be quite the production process. And it's probably a year away, I guess, if things go well. And that's a kind of a short estimate. Another way out is the population having enough immunity, so it's there aren't very many people that can still get sick, and we're a long way from that at this point. Probably it would take a couple of waves of it coming through our communities to establish that, and that's what happens with influenza. We have it every year, and after a couple of years, we have pretty good immunity to whatever that strain was. And I guess the third way is if there's some treatment drug available, but you know, even though there's a lot of research going on, there is nothing very promising in the way of treatment drugs so far. So it does look like we're kind of stuck with this situation for a while, and it's kind of it's not clear how long that while is. Most of these things come and go in waves, generally, and I think if we're lucky at this point, if we get a kind of a quiet summer here, we may well be in for a really problematic fall, because really we haven't had as big a problem so far as some of the bigger provinces. So that's why you have to just get used to living a little bit different till we're past this.
And I think so. The goal, as I understand it, then of the reopen plan, to kind of close the loop on that, is we're going to open up gradually, and if we're successful in maintaining vigilance and maintaining physical distancing and maintaining cleaning and disinfecting, we can prolong the length of time that we can remain open, which allows us to continue to move forward as a society, but recognizing that we're going to need these protective steps in place for the foreseeable future. And that's probably more than just a couple of months. It's probably many months. Is that fair to say?
Yeah, that's a good summary. I mean, everybody's heard the phrase flattening the curve that nobody had heard before about 2 months ago. And we wanted at such a low level, at a low enough level that our healthcare system can cope with the amount that there is around. And certainly we don't want to be in the position that Italy was, or Spain right after that, or New York. I mean, there's a whole series of examples. And there's no reason why that couldn't happen to us if we're not careful.
Okay. Thanks, Dr. Findlater. Tim, any last word from you on that? Because I know we were talking on some of the topics that touch on your field there too.
Yeah, I guess in closing comments here, I just want to say that the only reason why we're being able to move to reopening Saskatchewan is because of the cooperation and vigilance on the part of all in the province to adhering to the restrictions. And you know, that's we thank all the folks, including the construction agencies and businesses, for doing that, because otherwise we would be dealing with a much greater issue at this time. But as just to echo what Dr. Findlater said, is that we must maintain that vigilance over the next number of months. We all want to get back to normal as quickly as possible, but it's going to take time, and we have to do it in a controlled manner and do it in a safe manner. Thank you.
Okay. Well, thank you, Tim. Thank you, Dr. Findlater. Thank you, Collin. Thank you, Ray, for making time today. Thanks to all of our participants who joined us. A reminder that this session has been recorded, so it will be available for viewing later. All our IT foibles and everything included, so it'll be there for posterity's sake. Thanks again to everybody. Have a great rest of your day. Take care and stay safe.